So this patient is in your office. The family would like some testing, is wondering what's going on. What are you gonna say? You already, you got your psychologist. You beginning to feel this is not an eating disorder. She's trying to catch up. She's not happy about losing 5 pounds. Um, what is your spiel? What are you gonna say here?
So, of course, with that history, this is very suggestive of rumination. And even though the patients don't come with a Rome criteria logo in right behind there in your office, and this is of course biased to that, I think clinically when it makes sense and clinic is there, I think in my point, when family wants testing, what they're really telling you is that they want to understand why their child is having the symptoms that they're having. That's in my mind what I've learned that testing means, because they don't want testing, and testing without saying what it is will only make you test again and again and again. And I think what I try to do in this setting to begin with, if it's the first encounter, it's to say, we don't need any testing because I know exactly what your daughter has. And this is rumination. And let me explain you what this is. And I'm going to walk you through this process. And this is there. And it varies, because I'm a firm believer that if you say this in the first visit, you're probably going to have a very few percentage of people who are not going to believe you and they want more testing. If you're the 10th doctor they see, it's going to be a lot harder for them to understand that all of these was just breathing or what they see or hear at that point. So I think having the family and the patient understand why the symptoms happen and what is going on and why you know what it is. And I try not to do that testing in the first place and put the label first and then see what happens, how they respond and what you get from there.